Hello, and welcome to the 67th version of the Ascend Health Show. I think it's our 67th episode. Anyway, I'm your host, Nick Angelis, and today I thought I would do an overview of all the shows we've done. Not all 67, just a general overview, because I've talked to so many experts in the area, and I have so many videos at this point that I'm worried that they're not all being used for the educational purposes they need to, because whenever I have a health problem, I'm always thinking, okay, who did I talk to? Who can fix this? And so I want the same ability to be used by basically everyone in the Akron area. So to begin with, I'll tell a really random story I heard on the internet. There's this guy in Cambodia, and he stepped on a landmine, and so he needed a prosthetic leg. Well, he went back to the rice paddies after he had gotten a prosthetic leg, but it was painful because, it's work in the water. He remembered what happened to him. He started crying, laid in his bed, wouldn't get up to work. And so the doctor said, well, we need to prescribe an antidepressant. And so the antidepressant they prescribed was a cow. The doctors bought him a cow because now he could be a dairy farmer instead and didn't have to go back into that environment that had caused him pain. And so when Western medicine came to Cambodia, like, oh, we already have antidepressants. We have cows. This works out fine. We just do something different. And it's a strange story, but it does show that often in the US, it's almost like we have a hammer and everything is a nail. That the phrase root cause is really overused. But sometimes instead of just saying, okay, here's something to make you feel better, we have to think, okay, what is causing this pain, whether it's physical pain, emotional pain, or both, and then who is the appropriate person to send this patient to. So for example, we talk a lot about pain on this show. So there's a variety of chiropractors, whether it's Health Source of Fairlawn or Integrity Chiropractic or Zeo Vitality Center. You can search through all our videos and see our discussions on migraines and sciatica and neck pain and the different treatments that people have. Some of them are cold lasers. We just talked to Dr. Kusei, and he has several non-invasive opioid-free methodologies to treat pain. He's an anesthesiologist, so my type of guy since I'm a nurse anesthetist. And there are so many ways out there that we can treat things without having to go the standard medical system. Now, another issue that we often have is that everyone wants something that's not the standard treatment. Well, a standard treatment is called a standard treatment because that's what we do for everyone, and it works the most often. So once in a while, someone will come to Ascend and say, hey, this medicine works for me, but do you have something better, something that's new, shiny, improved? And often we say, no, if whatever the first line treatment is for your ailment, if it's working, then a lot of times we don't need to have conversations about, oh, are we masking the pain? Are we just treating symptoms? Are we not getting to the root? Well, you had a problem, you took a pill, you got better. Sometimes it's not any more complicated than that. Maybe years down the line, if there's side effects or that pill isn't working anymore, then it's time to start the process of uncovering the root cause and doing all this work. But if something's working, it's okay for it to work. You don't have to earn your health. Congratulations, you are one of the people that the medicine's designed for all of us were working, and that's great. You don't have to feel guilty about it. It's great news. Just go live your life. There's no need to optimize yourself and be 110% and live the American dream and all that. That's great. So in other cases, that's where it's time to think outside the box. So we have Rachel, the occupational therapist, who does a lot of pelvic floor work. You've seen a lot from custom care rehab on these shows, whether it's dizziness or pain. And again, it's probably time to do another disclaimer. I did one about 4 years ago, a show that was only a disclaimer that basically said, yeah, listen to what we say, but at the same time, you can't count this as medical advice. You should also run it past your doctor. I mean, the least you can do is ask some nosy AI about it, although of course they don't know all about you. And do you really want that? That's a great question. So for pain, I just talked about chiropractors, the anesthesiologists, the physical therapists. Oftentimes, if it's more of an insidious issue, meaning that over the years you've slowly declined, that's where functional medicine is really helpful. So Dr. McElrath here in Fairlawn with Monarch Ideal Care. In Wadsworth, we have Practical Healing. Bethany Ortlip, the nurse practitioner, has been on the show, along with Sarah Logan and the rest of their team there. We've also talked about integrative medicine on the show. Again, if something has slowly gotten worse, sometimes functional medicine is the way forward, where we can look at the labs, we can look at the hormones. We've also talked to Forum Health here in Akron. In fact, that was our first show with Dr. Tara Scott. I think it was around 6 years ago, back at the beginning of COVID. What a miserable time. So, and finally, we can also talk about anxiety, depression, mood disorders. Sometimes it just is a nervous system malfunction. So we've talked about the vagus nerve with Dr. White over there in Rocky River with Empowered Health. There are many ways that just looking at your nervous system can take care of problems that you wouldn't think would have anything to do with the nervous system. That, no, I am just sad. What does this have to do with my vagus nerve? Well, again, we've talked to many therapists on this show. Rachel Whitehawk with her horse ranch. We've talked to Deep Waters Therapy, Emerge, and now Renew Counseling Services, talking about trauma. And of course, there's been many shows about relationships. Because if you think about it, human connection, human relationships, those actually affect pain receptors. You can make clear distinctions with dopamine, norepinephrine, all the neurotransmitters, glutamate, and just our social connections. The social determinants of health are 80% of what our health is. You would think that physical problems would be 70, 80%. No, a lot of this is actually social when we talk about health. That doesn't mean that it's not real. It simply means that our connections to each other play a much larger role in our health than we think they do. Again, going back to the cow story where maybe you don't need Prozac, maybe you need a cow. Who's to say? So sometimes if you think outside the box, there are solutions on changing a way that you're living your life. And I'm not saying that change your hair and your suicidal ideation will go away. But sometimes there are little tweaks that we can do that start the path back to wellness. So again, talking about therapists, we've had therapists from Carved Your Own Path here several times, talking about family dynamics, yoga, gambling. And really, my message here is that now that we've done 67 of these shows, it's not at all an infomercial. It's not meant to convince you to go to see some practice, change therapists, go to a different doctor. It simply is that sometimes in these shows, there's a seed of knowledge that can help you personally with your issue. That maybe you haven't been thinking of it the right way. Maybe you keep on trying something that the other 5 versions of this haven't worked, so why would a 6th work? Obviously at Ascend, we have transcranial magnetic stimulation. That's a unique treatment for depression, anxiety, and OCD. It's not medication. It's European. Many of the doctors and therapists that we have here talk about neurofeedback, biofeedback, these different systems that aren't as common in American medicine. But at the same time, the reason for the show is because all of the solutions that we mentioned, there's probably some variation of it on TikTok, Instagram. And that variation is a scam. It's a fad. It's some huge corporation trying to get all your money. And in this case, we're talking to independent practitioners who have their own clinic, that they have skin in the game, they live in our community, and so you can trust them as opposed to something that you just saw on a video online somewhere. So again, this is Nick Angelis from Ascend Health Center. We have EMDR and other types of therapy, psychiatry with a psychiatrist, Dr. Molina, and our 2, soon to be 3 nurse practitioners, now that Olivia Render is transitioning from a nurse to a psychiatric nurse practitioner, which we're so excited about. We also offer Spravato. It's a product Johnson & Johnson makes as a nasal spray for depression, as well as intravenous ketamine, IV infusions for health, whether it be vitamins or a variety of drugs that we feel are appropriate for you. And then, as I said, we also have TMS, and we're learning and growing every day, and we're happy that you're on this journey with us. So thanks for watching all of these shows here at Ascend Health Center on WCTV.
You are watching WCTV, Wadsworth Community Television.